What inspired you to pursue a career in nursing?
My journey towards nursing was genuinely sparked by a growing fascination with the medical field itself, even before I considered it a personal career path. I found myself drawn to understanding human physiology, the complexities of disease, and the intricate ways healthcare professionals work to restore well-being. This academic curiosity quickly evolved into a practical interest, especially as I observed the undeniable global demand for skilled healthcare providers. The idea that my work could have an impact beyond local boundaries, offering opportunities to learn and practice in diverse settings worldwide, became a very strong motivator. Furthermore, I have several cousins who are already nurses, and through their experiences, I gain a realistic and grounded perspective on the daily challenges and profound rewards of the profession. Their candid insights into the direct patient care, the teamwork, and the continuous learning environment solidified my conviction that nursing offered a unique blend of intellectual stimulation, compassionate service, and genuine professional growth that truly resonated with my aspirations.
Why are you interested in working as a new graduate nurse at our hospital?
I'm truly excited about the opportunity to begin my nursing career at your hospital because of its outstanding reputation for patient-centered care and its commitment to new graduate development. During my clinical rotations, I consistently heard positive feedback from instructors and experienced nurses about the supportive environment here, particularly how much emphasis is placed on mentorship and continuous learning. I was especially impressed by your hospital's innovative programs, such as your simulation lab training and the structured preceptorship program, which I believe are invaluable for transitioning from student to confident, competent nurse. Furthermore, your hospital's dedication to community outreach and its strong presence in addressing local health needs deeply resonates with my personal values of providing compassionate, accessible care. I'm eager to contribute to a team that prioritizes both clinical excellence and holistic patient well-being, and I feel confident that your institution provides the ideal setting for me to grow and develop into a highly skilled nurse.
Where do you see yourself in nursing in 5 years?
In 5 years, I envision myself as a highly skilled and confident registered nurse, having solidified my foundational knowledge and clinical skills. I plan to specialize in a particular area, potentially critical care or emergency nursing, as I'm drawn to fast-paced environments and complex patient cases. I aim to gain advanced certifications relevant to my chosen specialty, constantly expanding my expertise. Beyond direct patient care, I hope to take on a mentoring role for new graduate nurses, just as I'll be learning from experienced colleagues initially. I believe in giving back and helping to onboard the next generation of nurses effectively. I also want to contribute to evidence-based practice by actively participating in unit-based quality improvement initiatives or nursing research, always seeking ways to enhance patient outcomes and improve healthcare delivery.
What do you hope to gain from your first nursing role?
In my first nursing role, I primarily hope to gain a solid foundation of practical clinical skills and confidence in managing diverse patient populations. While nursing school provided invaluable theoretical knowledge and simulated experiences, I understand that real-world application, critical thinking in high-pressure situations, and independent decision-making are developed on the job. I'm eager to refine my assessment skills, master medication administration safely, and become proficient in various nursing procedures. Beyond the technical aspects, I'm keen to develop my communication and teamwork abilities within a multidisciplinary healthcare setting. I want to learn how to effectively collaborate with physicians, allied health professionals, and experienced nurses to ensure comprehensive patient care. I also look forward to building my resilience and time management skills, navigating the demands of a busy hospital environment. Ultimately, my goal is to become a competent, compassionate, and reliable member of a nursing team, ready to contribute positively to patient outcomes and continuously grow my professional practice.
Describe your most valuable clinical experience during nursing school. What did you learn from it?
My most valuable clinical experience during nursing school took place during my rotation in the intensive care unit. I was assigned to a patient, Mr. Sharma, a 70-year-old gentleman who was recovering from a major cardiac event and was on a ventilator. Initially, I felt quite intimidated by the complex machinery and the critical nature of his condition. My task involved assisting with his daily care, monitoring his vitals meticulously, and documenting his progress, all while working closely with his primary nurse. What made this experience so impactful was not just the exposure to high-acuity nursing skills, but the profound lesson in holistic patient care and communication. Mr. Sharma was unable to speak due to the ventilator, and his family was understandably anxious. I learned to anticipate his nonverbal cues, to communicate using a whiteboard, and to provide comfort through touch and reassurance. I also saw firsthand how the nurse acted as a crucial link between the patient, his family, and the multidisciplinary team. Through this experience, I learned that nursing isn't solely about managing medical equipment or administering medications. It's fundamentally about connecting with another human being in their most vulnerable state. It taught me the immense importance of empathy, patience, and effective nonverbal communication. I also gained a deep appreciation for the collaborative effort required in an ICU setting, seeing how every team member's role contributes to patient recovery. This rotation solidified my passion for nursing and reinforced my commitment to always prioritize the human aspect of care, even in the most technologically advanced environments.
Tell me about a time you made a mistake during your clinical rotations. How did you handle it, and what did you learn?
During one of my early clinical rotations on a medical surgical unit, I had an experience that, while minor in outcome, taught me an invaluable lesson about vigilance and the importance of double-checking. I was preparing to administer morning medications, and due to the busy atmosphere and my eagerness to stay on schedule, I nearly administered a medication to a patient at 9 a.m. that was strictly ordered for 9 p.m. I had quickly scanned the medication administration record, mentally noting the 9, without fully processing the PM designation. Fortunately, just as I was performing my final check before administering the medication, crucial 5 rights, I paused. Something felt off, and I decided to take an extra moment to reread the order carefully, specifically looking at the time. That's when I caught the PM. My heart definitely raced for a moment. I immediately brought the issue to my clinical instructor. I explained what had happened, showed her the medication, and articulated how I had almost made the error. She calmly reviewed the situation with me, reinforcing the critical importance of the right time and the need for meticulous attention to detail, especially when feeling rushed. She also praised me for catching it and for reporting the near miss transparently. What I learned from this experience was profound: never to compromise the 5 rights of medication administration, no matter how busy or confident I felt. It drilled home the necessity of slowing down, focusing intently on each step, and trusting my intuition if something felt even slightly amiss. It also highlighted the importance of accountability and seeking guidance immediately, even for a near miss, as every such instance is a learning opportunity that ultimately protects patient safety.
What do you consider your greatest strengths as a new nurse?
My greatest strength as a new nurse is my eagerness to learn and my strong adaptability. While I may not have years of independent clinical experience yet, I bring a solid theoretical foundation from my nursing program, coupled with extensive clinical rotations that expose me to diverse patient populations in healthcare settings. I'm incredibly detail-oriented and meticulous, which I believe is crucial for patient safety, especially when it comes to medication administration, documentation, and adhering to protocols. During my clinicals, my preceptors often commended my ability to quickly grasp new concepts and integrate feedback into my practice. Furthermore, I have excellent communication and interpersonal skills. I'm adept at actively listening to patients and their families, conveying information clearly and empathetically, and collaborating effectively within a multidisciplinary team. I understand that building trust and fostering clear communication are essential for providing holistic and patient-centered care. I'm excited to bring this blend of foundational knowledge, meticulousness, and strong interpersonal skills to your team and contribute positively from day one.
What areas of your nursing practice do you feel you need to develop further as a new graduate?
As a new graduate nurse, I believe one key area I'm eager to develop further is my time management and prioritization skills in a high-acuity real-world setting. While nursing school simulations and clinical rotations offered exposure to managing multiple patients, the sheer pace and unpredictable nature of a busy hospital floor often present unique challenges. I've learned the importance of creating a systematic approach to my day, but I know that refining this skill to anticipate patient needs, efficiently group tasks, and seamlessly adapt to unexpected changes will be crucial for independent practice. Another area I am keen to strengthen is my confidence in independent decision-making and rapid critical thinking. During clinicals, I always had the immediate support and validation of my instructor or preceptor. While I'm proficient in identifying abnormal findings and escalating concerns, I want to build that deeper level of confidence where I can quickly synthesize information, prioritize interventions, and make sound clinical judgments with increasing autonomy. I plan to achieve this by actively seeking mentorship, asking clarifying questions, thoroughly researching unfamiliar situations, and reflecting on my daily experiences to continually refine my assessment and decision-making abilities. I see both of these areas as natural growth opportunities for a new nurse, and I am committed to dedicating myself to their continuous improvement.
How do you prioritize patient care when you have multiple tasks to complete?
When faced with multiple tasks, my priority is always to ensure patient safety and well-being through a systematic approach. I typically use a combination of frameworks to guide my prioritization, starting with the ABCs: airway, breathing, circulation, for immediate life-threatening concerns. After ensuring stability, I consider the acuity and urgency of each patient's needs. For example, a patient experiencing a sudden change in vital signs or showing signs of distress would immediately take precedence over routine medication administration or a less urgent dressing change. Time-sensitive tasks, like administering critical medications at their exact scheduled times or completing urgent assessments for new admissions, also rank highly. I then factor in patient comfort and basic physiological needs, like toileting or pain management, trying to group these tasks efficiently to minimize interruptions and maximize care quality. I also understand the importance of effective communication and delegation. If I have multiple time-sensitive tasks that I cannot realistically complete alone, I will communicate with my charge nurse or collaborate with colleagues to ensure all patient needs are met safely and efficiently. My goal is to always anticipate potential issues and address the most critical needs first, while striving to deliver comprehensive care to all my patients.
How do you ensure you are providing evidence-based care?
Ensuring I provide evidence-based care is fundamental to my nursing practice, as it directly impacts patient safety and positive outcomes. My primary approach involves a commitment to continuous learning and staying updated with the latest research and clinical guidelines. I regularly engage with professional nursing journals, review reputable online databases like PubMed and Cochrane Library, and attend webinars or conferences whenever possible to learn about new interventions, best practices, and advancements in specific patient populations. Beyond simply reading, I actively seek to integrate this evidence into my daily patient care. This means consistently reviewing and adhering to our hospital's current policies and protocols, which are ideally built upon strong evidence. If I encounter a clinical scenario where current practice seems to deviate from emerging evidence, I would utilize critical thinking skills to evaluate the evidence, discuss it with my preceptor or charge nurse, and potentially advocate for a change if warranted, always keeping the patient's preferences and clinical expertise in mind. My goal is to ensure that every intervention I perform, every decision I make, is supported by the most current and robust scientific evidence available, thereby providing the highest standard of care.
Describe a time you had to work with a challenging patient or family member. How did you handle the situation?
Working with challenging patients or family members is certainly a part of nursing, and I've had experiences that have taught me a lot about patience and communication. During one of my clinical rotations on a general medical ward, I was caring for a patient, Mr. Davies, who was extremely frustrated with his recovery progress. He was quite vocal and irritable, often snapping at staff and even his family members. His daughter, who visited frequently, was equally distressed and quite demanding, constantly questioning every aspect of his care. My immediate approach was to listen actively and empathetically. I realized that their frustration likely stemmed from fear and a feeling of powerlessness. Instead of becoming defensive, I tried to validate their feelings by saying something like, "I can see how frustrating this must be for you and your father, and it's completely understandable to feel this way when recovery isn't as quick as you hoped." I made sure to allocate extra time during my rounds to sit with Mr. Davies, allowing him to voice his concerns without interruption. Similarly, with his daughter, I took the time to explain the rationale behind interventions in clear, simple terms, answering all her questions patiently, even if they seemed repetitive. I focused on setting clear expectations and involving them in small aspects of care where possible. For instance, I'd ask Mr. Davies about his pain level and discuss the plan to manage it. With his daughter, I'd update her on his progress and enlist her help with things like encouraging fluid intake. By consistently demonstrating that I was listening, respecting their feelings, and was committed to their well-being, I found that their demeanor gradually softened. The situation taught me that what often appears as challenging behavior is frequently an expression of underlying anxiety or unmet needs, and that patience, active listening, and clear communication are the most powerful tools a nurse possesses.
How do you handle stress and maintain your well-being, especially during demanding periods?
In a demanding profession like nursing, managing stress and maintaining well-being are absolutely crucial, not just for personal health but also for providing optimal patient care. My primary strategy revolves around proactive self-care and establishing clear boundaries. During demanding periods, I ensure I prioritize the fundamental aspects of my well-being. This includes making conscious efforts to get adequate sleep, even if it means sticking to a strict bedtime routine on my days off and before shifts. I also focus on consistent, healthy nutrition to maintain my energy levels, and I try to incorporate some form of physical activity, even if it's just a brisk walk, to help release tension. Beyond physical self-care, I rely heavily on mindfulness and connection. Taking a few moments for deep breathing exercises during a shift can help recenter me. Outside of work, I make sure to carve out dedicated time for activities I enjoy, whether it's reading, pursuing a hobby, or spending quality time with friends and family. Maintaining a strong support system is vital. I have friends and former classmates in nursing with whom I can openly discuss challenges, share experiences, and receive mutual encouragement. I've learned that acknowledging stress and actively engaging in these practices helps me recharge, process challenging situations, and ultimately return to work feeling more resilient and prepared.
Describe a time you had to communicate a difficult piece of information to a patient or their family.
Working with patients and their families often involves delivering challenging news, and I recall a particularly difficult instance during my palliative care rotation. I was assisting the primary nurse in caring for a patient, Mrs. Green, who had been admitted with advanced cancer. Her adult son, who was her primary caregiver, was initially very optimistic about her prognosis, despite the doctors having communicated the severity of her condition previously. My role involved preparing Mrs. Green for discharge back home with hospice care, and part of that preparation included reinforcing the realities of her declining health with her son, who was struggling to accept it. The challenge wasn't just what needed to be said, but how to deliver it while maintaining hope and dignity. I observed the primary nurse gently initiate the conversation, focusing on Mrs. Green's comfort and quality of life goals for her remaining time. My part was to then provide practical details about hospice services, pain management at home, and what to expect as her mother's condition progressed. I used clear, empathetic language, avoiding medical jargon, and consistently checked for his understanding. I acknowledged his feelings of grief and denial, validating his hope but gently guiding him towards understanding the shift in focus from curative treatment to comfort care. I offered resources for caregiver support and emphasized that even though the focus was changing, he wouldn't be alone in caring for his mother. This experience deeply reinforced the importance of compassionate honesty and active listening in nursing. It taught me that delivering difficult news isn't a single conversation, but often a process of ongoing support and education. I learned the power of validating emotions, providing practical guidance, and ensuring families feel supported, even when the news is heartbreaking. It truly highlighted the nurse's role not just as a clinician, but as a crucial emotional support and information bridge during the most vulnerable times.
How do you seek help or clarification when you are unsure about something in your practice?
Ensuring patient safety is always my highest priority, which means I will never hesitate to seek help or clarification when I am unsure about any aspect of my practice. My immediate action would be to approach my preceptor or the charge nurse on duty. I would clearly articulate my uncertainty, provide all relevant patient information, and explain my thought process up to that point. I believe in being transparent about what I know and what I need to learn. If my preceptor or charge nurse isn't immediately available, or if it's a very specific clinical question, I would then consult our hospital's established policies and procedures, or refer to reliable resources such as drug formularies, evidence-based nursing guidelines, or approved online databases. I also understand the value of consulting with experienced colleagues who have specialized knowledge, or reaching out to the physician for clarification on orders or patient management plans when appropriate. My aim is always to ensure that I am acting within my scope of practice, adhering to the highest safety standards, and continuously learning from every situation where I need to seek guidance. I view every instance of seeking clarification not as a weakness, but is a crucial step in delivering safe and competent care and fostering my professional growth.
What does teamwork mean to you in a nursing environment? Can you give an example of how you contribute to a team?
In a nursing environment, teamwork means far more than simply working alongside colleagues. It's about active collaboration, mutual support, and a shared commitment to achieving the best possible patient outcomes. For me, it embodies seamless communication, where everyone is informed and contributes their unique skills and perspectives. It means stepping up to help a colleague without being asked, anticipating needs, and maintaining a positive, professional attitude, even during high-pressure situations. Ultimately, effective teamwork ensures continuity of care, reduces errors, and creates a safer, more efficient, and more supportive environment for both patients and staff. During one of my clinical rotations on a busy surgical ward, I had a tangible opportunity to contribute to the team. The unit was short-staffed, and one of my assigned nurses was managing two critically ill post-operative patients while also having a new admission. Recognizing her workload, after I had completed my priority assessments and medication passes for my own patients, I proactively offered to assist. Specifically, I helped her prepare the room for the new admission, gathered necessary supplies for a wound dressing change on one of her stable patients, and offered to assist with a patient transfer she needed to complete. This allowed her to focus on the more acute needs of her critical patients and the essential initial assessment for the new admission without feeling overwhelmed. It alleviated some of her immediate pressure, ensuring timely care for all her patients and fostering a sense of shared responsibility among the team.
You receive a handoff report for a patient. What are your immediate priorities for your first assessment?
Upon receiving a handoff report for a patient, my immediate priority is to synthesize the critical information to form a rapid initial assessment plan, always with patient safety as the cornerstone. First, I mentally prioritize patients based on their acuity and any recent changes in their condition highlighted in the report. The most unstable or those with impending issues would be seen first. My very next step is to perform a quick environmental safety scan upon entering the patient's room. This involves checking for fall risks, ensuring the call bell is within reach, and verifying that any essential equipment, like oxygen or floor pumps, is functioning correctly and set appropriately according to orders. Simultaneously, I perform a brief visual assessment of the patient's general appearance, noting their level of consciousness, skin color, breathing pattern, and any obvious signs of distress. Following this initial safety scan and observation, I would then proceed with a more focused assessment, guided by the handoff report. If the patient has a cardiac history, my assessment would lean heavily on their cardiovascular status. If respiratory, I'd focus on breath sounds and oxygenation. I would also quickly review any immediately due medications or time-sensitive orders, ensuring I have a clear understanding of the next steps in their care. Finally, I make sure to introduce myself to the patient and their family, establishing rapport and letting them know I am their nurse. This comprehensive yet rapid approach allows me to gain an initial understanding of the patient's status and prioritize my subsequent actions effectively.
A patient's vital signs suddenly change. What would be your immediate steps?
If a patient's vital signs suddenly change, my immediate and overriding priority is patient safety. My first step would be to assess the patient directly and thoroughly, rather than just reacting to the monitor. I would quickly go to the bedside and perform a rapid, focused assessment, starting with their ABCs: airway, breathing, circulation. I'd check their level of consciousness, respiratory effort, skin color, and temperature, and assess their pulse quality. This helps me understand the patient's immediate clinical status and whether the vital sign change reflects a true deterioration or perhaps a technical issue with the monitoring equipment. Simultaneously, I would call for help from a colleague, my charge nurse, or activate a rapid response team, depending on the severity of the change. While waiting for assistance, I would initiate any immediate, appropriate nursing interventions within my scope of practice. For example, if a patient's blood pressure suddenly dropped, I would position them supine, potentially elevate their legs if not contraindicated, and ensure for access is patent. If oxygen saturation dropped, I would ensure airway patency and administer supplemental oxygen. I would remain with the patient, continuously monitoring their response and providing updates to the team. Accurate and timely documentation of the vital sign change, my assessment, interventions, and the patient's response would follow once the immediate crisis is managed.
How do you ensure medication safety when administering drugs to a patient?
Ensuring medication safety is paramount in nursing, and I approach it with a systematic and meticulous process. My primary framework is always based on the 8 rights of medication administration: the right patient, right drug, right dose, right route, right time, right documentation, right reason, and right response. Before I even access any medication, I first verify the physician's order against the patient's medication administration record for accuracy and completeness, checking for any allergies and ensuring the medication is appropriate for the patient's current condition. I perform my first check when retrieving the medication, confirming it against the march. Then, as I prepare the medication, whether it's drawing up an injectable or counting tablets, I perform my second check. At the patient's bedside, I use at least 2 patient identifiers, such as their name and date of birth, and utilize barcode scanning technology if available to ensure I have the right patient and the right medication. This is my third and final check. Before administering, I'll explain the medication to the patient, its purpose, and any potential side effects. After administration, I document immediately and monitor the patient for any adverse reactions or the desired therapeutic effect. If at any point I have a question or feel unsure about an order, I always seek clarification from a more experienced nurse, charge nurse, or the prescribing physician before administering the drug, as patient safety can never be compromised.
What would you do if you witnessed a colleague making a mistake in patient care?
If I witnessed a colleague making a mistake in patient care, my immediate and overriding priority would be patient safety. My first action would be to intervene calmly and discreetly at the moment the mistake is occurring or immediately after, if possible, to prevent or mitigate any potential harm to the patient. For example, if it were a medication error, I might calmly say, "Excuse me, could we just double-check that medication together?" Or if it were an unsafe procedure, I would offer assistance to correct it immediately. Once the immediate patient safety concern is addressed, I would then seek to have a private and professional conversation with my colleague. I would approach them with a non-judgmental tone, focusing on the incident itself rather than personal blame. My aim would be to understand what happened, ensure they are aware of the mistake, and discuss how to prevent its recurrence. This collaborative approach fosters a culture of safety where errors can be learned from. If the mistake had the potential to cause patient harm, or if actual harm occurred, or if my colleague was unreceptive to the discussion, I would then promptly report the incident to our charge nurse or unit manager. This is essential to ensure proper documentation, follow hospital policies regarding error reporting, and to facilitate any necessary investigation or system-level changes that could prevent similar mistakes in the future. My ultimate responsibility is always to the well-being of the patient,